Coronavirus Awareness Campaign. A special message from Hiral and Jahal Charan. Coronavirus. Coronavirus is a respiratory illness. Prevention is better because there is no cure. Coronavirus typically affects respiratory tract of mammals, including humans. Coronavirus is associated with common cold, pneumonia, and severe acute respiratory syndrome. Coronavirus symptoms: fever, headache, cough, runny nose, throat pain, having difficulty breathing, body ache. People who are at higher risk. Persons who are older or weaker immune system may have a higher risk of experiencing severe symptoms including pneumonia or severe acute respiratory syndrome. The death ratio is less than 2% of those affected by coronavirus. Things to do: keep yourself safe and even others. Practice respiratory hygiene. While coughing or sneezing, cover your mouth with tissue or flex elbow. Throw tissue into closed bin immediately after use. Don't use your hands for coughing or sneezing, since your hands' bacteria can now easily be transmitted to others with various contact with surfaces. Maintain social distance. Maintain at least 1 meter, that is 3 feet distance between yourself and anyone who is coughing or sneezing. Keep utmost care of personal hygiene. Keep your hands clean by washing them with soap and water frequently. Wear a mask if you are sick so that others be safe. Make use of alcohol-based hand sanitizers to keep hands clean when washing with soap and water is not possible. If sick or healthy, don't touch your eyes, nose, and mouth with your hands, since your hands touch many surfaces. If you have cough or fever, then avoid close contact with other people till you are recovered. Try to keep your environment as much clean as possible. Not to travel to various countries affected by coronavirus. Try to avoid crowded places. Stay informed and follow advice given by government and health authority. Our greatest weapon right now is to not let the virus spread by taking precautions and thus flattening the curve. Proper use and disposal of mask. Before putting on mask, wash your hands with soap and water or alcohol-based hand sanitizer. Cover mouth and nose with mask, making sure there are no gaps between your face and mask. Avoid touching your mask while using it. If you do, wash your hands. Replace the mask with new one as soon as it is damp, and do not reuse single-use mask. To remove the mask, remove it from behind. Do not touch the front of the mask. Discard masks after use in closed bin and wash your hands afterwards. Preventive measures. Avoid contact with people who are sick. Stay home when you are sick. Wash hands often with water and soap, 20 seconds or longer. Avoid public transport and large crowd when sick. Dry hands with a clean towel or air dry your hands. Get adequate sleep and eat well-balanced meals. Cover your mouth with a tissue or sleeve when coughing or sneezing. Avoid touching your eyes, nose, or mouth with unwashed hands or after touching surfaces. Clean and disinfect high-touch surfaces often and keep surroundings clean. Call before visiting your doctor. Practice good hygiene habits. Join Swarn Bharat's effort to fight against world pandemic coronavirus.